If you've ever noticed what looks like flakes or tissue chunks in your period blood and you're wondering if something is going on, this video is for you. I'm going to break down what this could mean and when you should be concerned, and a little bit about treatment too. First, let's talk about what's normal. Your period isn't just pure liquid blood. It's your uterine or uterus lining shedding. So some small clots and some tissue once in a while can be totally normal, especially if it's on a heavier day of flow. But here's what to watch for. If you're seeing larger tissue pieces or consistent flakes of tissues, especially if you have other symptoms like pain, fever, heavy bleeding that soaks through a pad in an hour or less, any sort of smell, itching, or discomfort, that could signal inflammation from things like bacterial infections, like bacterial vaginosis, PID, and even endometritis. When you have bacterial infection or inflammation, they can cause your uterine lining to shed differently, sometimes in larger and more noticeable pieces. This is because your body is literally trying its best to clear out the infection. Here's something that I think is also really interesting. Some specific bacteria create protective biofilms that stick to your tissues like a slimy shield. Now, when your body finally breaks these down, you might see that film-like unusual tissue in your period. It's literally your body shedding the infected biofilm material. If what you're dealing with is a bacterial infection or inflammation, here are 3 key treatment tips your doctor might not tell you. Number 1 is, even if your sexual partner has no symptoms, they have to be treated too. Bacteria love playing ping pong between partners, and you could spend all this time and energy clearing out your infection and then get reinfected the very next time you're intimate. So don't let your hard work go to waste. Tip 2 is, remember that biofilm I mentioned. Breaking it down first can help antibiotics reach the bacteria and work better. This is where things like boric acid suppositories and other medications can be game changers and improve your outcomes because they help disrupt that protective shield so the other treatments can do their job faster and better. And number 3, not all antibiotics are going to work for all bacteria. Different strains respond to different medications. So your doctor might need to test and culture which specific bacteria you have and then choose the most effective treatment. Don't just assume any treatment will work, or if you did one treatment and it didn't work, that's the only option. There might be better fits. The bottom line is, trust your gut and your knowledge. If something feels different or off about your period, especially if you've got those other symptoms, don't wait. See your healthcare provider for proper testing. This can be a quality of life issue. It can also affect your fertility. Remember, I'm sharing educational information here, not medical advice. Every single body is different, so when in doubt, be sure to check with your professional. Quick bonus tip, check out my reel about how to do vaginal probiotics. This is another amazing layer for both during treatment and for prevention of recurrence. The good bacteria will help crowd out and prevent the bad guys from coming back. And if you've experienced this and have a treatment that you'd recommend, or a story or a cautionary tale, please leave it in the comments so that we can all work together and feel less alone and feel better faster. Thanks for watching.